Okuku. I'm a consultant medical oncologist at the Uganda Cancer Institute. This month of November, we would love to update you on issues regarding prostate cancer. This is a cancer that is quite common in Uganda among men, not only Uganda, the whole world, including Africa. There are lots of men that we are losing because of this cancer. So prostate cancer is a small, prostate itself is a small organ that is located just below your bladder. Your urinary bladder is a very important organ that stores urine. It's a very important organ that stores urine. So below that organ is a small walnut organ called a prostate. It's only found in men. Women do not have prostates. And it has a very important function. There's no man who can have children without a prostate, because it produces secretions that help the eggs, the male eggs, to survive. And so it's a very important organ. But oftentimes it gets diseased, and there are two main types of diseases that we normally see. We have just an enlargement of the prostate. We call that enlarged prostate, or if you like, benign prostatic enlargement. That's very common among men above 50 years. But we also have a very dangerous entity that we refer to as prostate cancer. This is when this small organ gets diseased, gets cancer, and that can be very dangerous. That prostate cancer has many ways in which it can grow in different men. By and large, many of the men develop slow-growing type of prostate cancer. And this may not be detected during their lifetime, and they will just die with it without having issues. Approximately about 85%. However, there are other men who, about 15%, who may develop a very aggressive type of cancer in that prostate. And there are very different subtypes of this disease that affects men in different places of the world. But those 15% will need treatment because they will have a very aggressive type of disease in their prostates. So that small organ, once diseased with cancer, the cancer will begin to spread outside the organ. The neighboring organs there include the bladder, which is usually a culprit. And that's the reason why most times men with prostate cancer will have urinary symptoms. And the symptoms urinary symptoms tend to be the early symptoms. For example, if the tumor invades your bladder volume may reduce, and that will require you to keep emptying very frequently. Also remember that the bladder has an exit, which we call a urethra. And that urethra goes through the prostate before it exits the body. So that urethra has a section in which it exits through the prostate. We call that the prostatic urethra. So sometimes the symptoms may include obstruction to urine. Man is not able to pass urine. And sometimes if this tumor invades the bladder, eats up the vessels, there will be blood in the urine. But most men will have a frequency, an urgency, a hesitancy, obstruction, poor stream before they get other complications. So the symptoms are usually around there. The man will avoid drinking sometimes. If he's in a meeting, he will avoid taking fluids, because once he takes fluids, then he will be irritated, and the bladder will be irritated, and he will need to go for visit the toilet many times. We call that paying your big water bills. So he ends up going for paying water bills many times when he's in a meeting. So many men try to avoid that, which is not a good thing. Eventually it might lead to your kidney not working well. So What happens next? So after this tumor has gone into the bladder, there will be those symptoms I've described. There may be blood, as I mentioned, but usually they will be just irritating symptoms. They irritate the bladder. The man goes to pass urine many times. He probably has pain there. He has urgency. He needs to run very quickly to pass urine, and if he does not get there in time, then he will pass it on himself. So all these are not very comfortable symptoms. What are the late symptoms of this disease? The late symptoms can actually include lymph nodes in that abdomen, which are blocking flow of either blood or lymphatic drainage. And then you find men have swollen feet. The legs are swollen. They may develop blood clots. When you have impairment of those flow of the lymphatics and the blood, you can actually develop a blood clot in the lower limbs. There could be blockage of the rectum, because the rectum is also a neighbor of this whole organ on the posterior side, on the behind side. So there can also be constipation. There can also be diarrhea if the tumor is invading the rectum. There can be bone pain. Tumor commonly goes to the bones of the back. We call that the vertebrae. It can go there and it can impair the function of the vertebrae. The man may not be able to walk. We call that spinal cord compression. There can be a fracture of any of the bones invaded by this cancer. So apart from the pain, there can be a fracture. We call that pathological fracture. So there are many complications eventually that can come. And remember that some of the symptoms are silent in most of the men and may not have any symptoms, or they may be what we call subtle. In other words, they are there, but it's very difficult for a man to detect these symptoms. So that is how complicated prostate cancer can be. The people who are at risk include men who are about 50 years. 50 years of age, but in Uganda, most of our men are diagnosed between 60 and 70. However, we believe the disease will have started much earlier, maybe 5 years or 6 years earlier before diagnosis. People who are born in families where this disease has been diagnosed, prostate cancer, family history of prostate cancer, are at greater risk, especially young men in their 40s. There are young men in their 40s who develop this disease, and those are mainly those who have a family history. It's a very serious situation, and those men are taken as high risk. They need to be on a surveillance. They need to be checking frequently because of the high risk hereditary component of prostate cancer. So age is a very important factor for this disease. Young people in their 20s cannot develop prostate cancer, normally starting at 40 onwards, and that's the age at which we also do what we call screening. Screening is really a method where you have no symptoms of cancer, but we take you on to check and see whether there are any signs of cancer in your body. So those are the other risk factors. Of course, include diet. If you're eating too much, and doing less exercise and putting on too much weight, it's not a good thing. That can increase your risk of not only prostate cancer, but other non-communicable diseases that we call NCDs, including heart disease, including diabetes, including high cholesterol, including pressure, blood pressure, high blood pressure. So all these are complications, but how do we prevent? Yes, we can prevent. Sometimes we may be successful, sometimes we may not be successful, but generally keeping a lean body is one way. Reducing on red meat is the other way. Reducing on alcohol, smoking is the other way. Regular exercise is the other way. Fruits and vegetables, plenty in your diet is the other way. Avoiding habits that could endanger your life, really, So keeping a healthy body is very, very important, not only for this disease, but also for the other NCDs that we have mentioned. So we have a challenge that is going on in this country. Over 800 men at least come to this institute here. But if you add up in our other centers in Barara, in Arua, we are close to 1,200 men who actually are diagnosed with prostate cancer on a yearly basis. We do not have a good system where men come to be checked all over this country. However, this information is for you, the men, or for you who are listening, that encourage men who have issues with their urinary system to go and have a check at any facility, health facility around the country. We do offer, as Cancer Institute, free services at our branches. First of all, here at the main center at the Cancer Institute in Mulago. We have a daily clinic that runs free of charge. You can come and speak to a doctor and have you checked. We have a Mbarara clinic that runs within the main hospital. In Gulu, we shall be opening a branch there very soon, and the government has already finalized plans to have another branch in Bali as well. We have rural branches in this country. We have one in Mayuge district, where we operate a screening program for local people in Mayuge district, because that's one of the districts where we record very high levels of cancer in the country. So we have a clinic there that we usually run to be sure that we help the men. So in brief, this is a little about prostate cancer in this month of November. May I also encourage men who are about 40 years to go and have a check, but especially men who are having urinary symptoms, to take it upon yourself during this month of November to have a check, have yourself checked for prostate cancer. Thank you.